Hi everyone, this is Dr. Saida Fallofini from Cal Poly Pomona. In Module 2, we are going to look at the systems and the complexity in the healthcare system and so forth. So we're going to learn what is a system, what is system of system, what do we call by sociotechnical system, as well as enterprise systems, and why do we need to use systems engineering for healthcare. We just talk about what is definition of a system, a set of interrelated components that are working together to achieve some common objectives, right? And we all know why healthcare setup is a system. We know what are the components, they are working together, they are interrelated, and their common objective is to maintain or restore the health of the population and individuals and patients. We also have system of systems. That's a definition that you guys have had in the systems engineering class. Okay, the system of system is a system in the first place, but it's a big system, and in the system, the components are a system on their own. But then when they come together, they achieve something that they cannot achieve alone. I think in the systems engineering class, the example that you guys have is the transportation system. We have the ground transportation system. It's working on its own perfectly, no problem. We have the airplanes and the air transportation system. It's working on its own, no problem. However, with the ground transportation alone, we may not be able to easily go from one continent to another, but when the ground transportation system and air transportation system come together, then they make this other possibility for us, which is going from one continent to another. So in system of systems, each one of the systems that exist in this big system of system, each one of those individual systems are valid and they can work on their own, but then they come together, they achieve something that they cannot achieve alone. A healthcare system is a system of systems. Can someone tell me why a healthcare system is a system of system?
So within a given hospital or location, you could have multiple different systems within there, and then the hospital itself is part of the larger healthcare system of, outpatient or healthcare or insurance.
That's correct. To a large extent, that's correct. So if we consider, for example, and some of the equipment. So, for example, there is this equipment in the hospital that can measure blood pressure. There is this equipment that can measure the level of oxygen in the blood. There is this equipment that can measure temperature and so forth. So all these systems work on their own. So you can take them anywhere. You can even bring them to your home. They can do the measurement for you. However, when each one of these singles, like for you, I think you mentioned pharmacy. So when we have pharmacy, okay, the pharmacy can work on its own. It doesn't need anything else. But when we bring all these systems together, all these equipments and devices that they are working on their own, they achieve their own specific objectives. But when we bring all of them together and they work together, they achieve something extra. They all together maintain or restore the health of a population. If we have only one of them, that may not be enough for us to be able to treat a patient. Okay, so a lot of these little systems that we see in a healthcare setup are individual systems. They can really live on their own. They can behave on their own. No problem. But when they come together, that's when through the collaboration between all these systems, we have a system of systems that can maintain or restore the health of an individual. So healthcare system is a system of systems. The other thing that I want you guys to know, and again, these are some vocabulary definition and things, and I'm mentioning those because as when you guys graduate as a systems engineer, it's important for you guys to know a lot of these terms. If you end up working in a healthcare setting, I want you guys to have heard this setup so that if the discussion comes up in a committee, in a meeting, and so forth, I want you guys to know this term. So this healthcare system is also a socio-technical system. What is a socio-technical system? It's a system in which people are important components of the system. and they affect how the system is performing. Healthcare system is all about people. We have patients, we have their families, we have a lot of healthcare professionals, doctors and nurses. So how the quality of the healthcare basically depends a lot on these people who are involved in the system. So when we have a system which not only has the technical part, all those devices and equipments and so forth, but also it significantly has the people part, and it's the collaboration of all these components that affects performance of the system. That's what when we call a socio-technical system. Okay. For example, if I'm looking at a car is a system, but I'm not going to call it a socio-technical system because it's very mechanic. Like it's a bunch of components, they come together. This is car. Okay. Obviously, if we have an insane driver, that can lead to accidents and things like that. But that's the car, and if some person follows these rules, it has to be able to safely go from point A to point B. So that's not something I would call a socio-technical system, but for a system in which people are important components, and also the behavior and decision of the people affects how the system is performing, that's what I call a socio-technical system. For example, right now we have the healthcare system in the US, right? And with the COVID and everything, the healthcare system is providing vaccination to the population. Okay. And however, this healthcare setup is performing poorly in some states and is performing a lot better in some states. Why? Can we say the vaccine is not good in some states or the vaccine is better in some other states? No, it's the same vaccine, the same quality of doctors that are working, the quality of nurses, quality of hospitals, let's assume. But what causes one state to perform better compared to another state is the people in the system. Some people decide not to get vaccinated. Some people decide to get vaccinated. So the decision of people or those patients or potential patients that can receive the vaccinations is the one that actually affects performance of the vaccination system in one state compared to another. So we deal with socio-technical system when people component is an important component of the system, when the decisions of the people in the system affects how the system is performing. There are actually a lot of systems around us, around as engineers, that are socio-technical. If we look at the evacuation system, so when let's say hurricane comes, or the flooding comes, or the fire in California, when there's a lot of fire, the government takes action for evacuation of people. However, these evacuation policies that the government puts, all these forces, are successful in one neighborhood and they're not successful in another neighborhood. For example, for hurricanes, there was an evacuation that they put in place in New York when one hurricane came that hit that area. And that evacuation strategy was not successful in New York, but the similar evacuation strategy was successful in Louisiana. Why this is the case is the similar evacuation strategies. Okay, go to these places, get these bosses, I don't know, go to these shelters. That's the strategy that the government comes up with and puts in place. But why some of them are successful and why some of them are not successful? Because the success of the evacuation system also depends on the people. This system has an important people component. Those people who are going to either perform the evacuation strategy or do not perform. You may tell me, leave your home, in the fire or the hurricane may get to you in 2 hours. I may not leave, or I may leave, or I may leave late, and I may cause traffic and block the roads for other people. So that's also a socio-technical system, because it's not just the technical part that says, okay, 1, 2, 3, put the bus here, put the shelter here. That's the technical part that the government and all those decision makers come up with, that how we should evacuate this population. That's the technical part of it. But there is a social part associated with it, and the social part is related to the population that is supposed to execute that evacuation order. And if the population does not listen and does not perform those orders properly, the evacuation strategy will be a disaster. So a lot of systems around us that we work in as engineers are actually socio-technical systems. They not only have a technical system, but they also have a social system. A strong people component and performance of the people affects how the system will perform at the end. In healthcare system, that's perfectly the case. Patients, families, and all the doctors, their decision at the end of the day affects what is the quality of the care that will be provided to them, to the patient. Another term that you guys may see, I haven't mentioned it here, but here, enterprise systems. Enterprise system is also another term. If you hear enterprise systems, also those are the systems that have a strong people component. Enterprise systems or socio-technical system, these are the systems that have a strong people component, and definitely healthcare system is a socio-technical system or an enterprise system. Yeah, that's what I mentioned here. And also, healthcare system is dynamic. What do we mean by that? A system is dynamic when the environment in which the system is performing is changing continuously, and that leads to the change in the system as well. We also you may hear the term adaptive systems. Healthcare system is also an adaptive system. The environment is changing, the environment is dynamic, and the healthcare system has to be able to react fast to all those changes in the environment and change as well. What are some of the examples of the change? Different technologies that we have for treatment of population. So as the technologies change, a lot of things in the healthcare system would change. Hospitals may require more space or less space, or the process flow may change. So, but they have to be ready for adopting those changes, and that's important. And the same again for the COVID situation was the case when the whole COVID started, and with the whole vaccinations and everything, they added a bunch of steps to their processes. Okay, when you get in, they control your temperature, they do this, they do that. They provided a lot of service that they previously didn't. Test for COVID, provide vaccination. So they previously didn't have these services, but now because the environment changed or because the technology changed, they have to be able to adopt, and that contributes to the dynamic nature of the healthcare system. And all of these, healthcare system being a complex a system of system, it's a socio-technical system, it's a dynamic system, it's an adaptive system, and all of these are the ones that actually contribute more and more in the complexity of the healthcare system. And as we mentioned in previous slide, the complexity of the healthcare system is the one that causes patient harm and can affect all sorts of performance factors, including accessibility and quality. Institute of Medicine, which is actually a very, very important institute, is similar to Institute of Engineers and so forth. And a lot of the policies and rules in the US are put in place by the Institute of Medicine, or IOM. Looking at actually a long list of the errors that had happened in the medical environment, to find out why these errors or these issues had happened in the medical system. And they basically concluded that this healthcare system that exists should be transformed. And they basically talk about a healthcare system for the 21st century. And they discuss some dimensions along which we have to be able to change the healthcare system. And again, these are some of the dimensions that we already have talked about, but again, safety of the patient, effectiveness. Does the healthcare system do the thing that they are supposed to do? Do they heal the people? Do they help maintain and restore the health of the people? Are they patient-centered or not? Do they consider the patient as an active member of the team? Do they care about the needs and values and preferences of the patient? Is the service that is provided timely or not? Is it efficient? How about the cost and equitable? Can all sort of people have access to the system? So they specified these 6 dimensions as the dimensions along which we have to be able to transform the healthcare system in the US. And in this document, they actually provide an extensive discussion on how potentially this can be done. But one of the main conclusions that they have in this the document is that that they appeal to engineers, and they appeal for partnership of engineering and healthcare so that they can improve healthcare delivery, they can improve provision of the healthcare to the patients. The collaborations between engineers and healthcare actually and healthcare system is something that belongs to many years back. We have biomedical engineering field, right? We have had all the basically devices and equipments, all the medical devices and equipments, and a lot of the treatments that have been innovated over time had been done by a lot of mechanical engineers, electrical engineers, chemical engineers, biomedical engineers, and so forth. So engineers have been present in healthcare field for many years. However, they have not been present in improving the delivery of the healthcare process, of the healthcare system, in delivery of the healthcare. So they haven't been able to help the healthcare system with the delivery of the service. And that's the part that basically Institute of Medicine wanted to focus on, how we can improve the delivery of the healthcare to the population. And they wanted engineers to be able to help them in that sense. And those engineers are basically systems engineers, industrial engineers, operations research people, a lot of people with a specialty in human factors, in risk management, in finance. Those are the type of engineers that actually can help healthcare system to improve delivery of the healthcare. And that's how the whole concept of systems engineering or healthcare systems engineering has received a lot of attention in the past 20 years, and I would say even more in the past 10 years. This is something that I have felt like has received a lot more attention. And when I joined Johns Hopkins for the postdoc of Johns Hopkins School of Public Health, they had received a $20 million grant from NIH, National Institute of Health. And the whole point of this grant, this $20 million, was for a center, for a 5-year center that they promised that they are going to build that center. And the main goal of the center was to bring systems engineer and industrial engineer who have interest in public health and medical field. And also they bring public health people and medical people who have interest in understanding the systems engineering part and the system thinking part. And they ask them to sit around a table and understand each other, understand each other's language, understand each other's problems, and work together to address public health and medical problems. So I was the person, for example, that I joined as the industrial and systems engineer who had interest in public health and was going to learn about public health and see how these tools and techniques that we have can be applied in public health. So that's what I mean. Like there has been a lot of effort, but that's something that I have seen a lot more in the past 10 years to happen. And systems engineering or system thinkings is definitely the one that can help us to address the issues related to the healthcare system because of several reasons. Healthcare system is really advanced in technology and high in cost. So, however, its operations have not been improved as much, and that there is a lot of room in improving the processes and improving the delivery of the healthcare system, and finding also the reasons for the high costs and how we can improve those. In the healthcare system is huge, and you saw there are a lot of components in this healthcare system, but they're not well integrated. For a system to be able to work properly, we want all these components to be really integrated, but healthcare system is hugely fragmented, and these components are not really well integrated. So healthcare systems engineering and system thinking help us to address that as well. It also helps us to make better decisions in terms of using human resources and all other resources in the system. And finally, systems engineering is great in terms of making trade-offs between different objectives. So if you remember, in the Institute of Medicine provided these 6 dimensions along which we have to improve or transform our healthcare system. We may think of an action or a decision that can improve safety a lot, but at the same time, it's going to cost a lot. So we improve one dimension, but we are going to do worse in another dimension. The one thing that systems engineering is going to help us to do is to make decisions as we create balance between all these factors that we have to take into account in our decision making. So that's something that, again, systems engineering, with all the tools and techniques that it has, would enable us to create those trade-offs between all those quality measures or performance measures that we need to think of. And again, systems engineering or system thinking are just these mindset that, to be able to understand what is going on in the healthcare system, we shouldn't just focus on one component. We have to look at all components and look at the big picture and understand the connection between all the components. And then we can see what's going on and what we can do potentially to make it change. And another term that I want you guys to also know, or you may hear in discussions or in other literature, is the term of lean healthcare systems engineering. And that's actually a very hot phrase that a lot of the healthcare systems, like a lot of hospitals, said, oh, we need lean healthcare systems and so forth. So basically, lean concepts or lean practices focus on removal of any waste that they may exist in any system and improving efficiency, improving cost. Okay, so the lean healthcare systems engineering is trying to do exactly the same thing, to improve all the waste and all the extra resources that exist in the healthcare system, and remove those and eliminate those and improve the efficiency while maintaining the quality and effectiveness of the system as well. In the healthcare system, if the components are not connected with each other, there will be, and actually there is, a lot of waste. There are a lot of times that in the healthcare system, we may see redundancy in operations. Patient 2 did an X-ray a week ago, but now the patient is going to another department. If the health information has not been transferred properly, the other doctor also may require the patient to do another X-ray. So that's a lot of cost to the healthcare system. And all of these type of redundancy and waste that exists in the healthcare system should potentially be removed if we want to improve efficiency of the healthcare system. And those are the things that happen under the lean healthcare systems engineering, which actually just simply tries to implement a lot of lean techniques and a lot of lean mindset that we learn in lean classes or lean textbook or education. So when we look at the healthcare system, we can look at it at in 4 different levels. This is what's called a 4-level model of the healthcare system by Fairley and Shortall. They are actually 2 of the researchers that have done some research in the healthcare system. And in this framework, basically, they provide 4 levels of the components that exist in the healthcare system. The first level is the patient. And as I said, a lot of healthcare systems are trying to be patient-centric, patient-oriented. try to consider the preferences, the values, and the requirements of the patient as they are developing the healthcare, as they are providing the healthcare. So that would be the first level. The next level is what they call as the care team. These are all the professionals, doctors, nurses, people in pharmacy, technicians, family, all the people who are basically are in touch with the patient. They are the ones who are making the decisions or are being affected by the decisions. But these are all the patients who are to some extent also involved in the decision-making process. The care team will be the second layer. The third layer will be the organization. So these are all the hospital, buildings, clinics, nursing homes, and so forth. So all the resources that basically are available to the care team. So the organization or infrastructure, resources, these are all the resources, all the infrastructure that are available to the care team so that they can work, they can function, and they can provide the care. And lastly, it's the environment in which the whole healthcare setup is working. All the policies, the market, the public and private regulators, the insurers, employers, all of those are the ones that are forming the environment. How the employers contribute to the insurance, how the insurers are providing different insurance programs, how the government put policies and regulations, and how basically the whole healthcare market is performing. So that's the another level that they have considered for the healthcare system. So these are just different. Again, these are all the components that we already talked about. Remember in that slide when I showed you what are the components: provider, patient, NGOs, I don't know, pharmaceutical components, government, and so forth. We talk about all of this, but these are just different perspectives to the healthcare system, and this is just another interesting perspective that just says how one layer lies on another, and so forth. And for the systems engineering method or approach to be able to be successful in the healthcare systems, we need every component of the system to recognize its dependence to the other units. And we want basically every unit, let's say the primary care unit or the pharmacy part or the labs. These are all different units or components of this healthcare system. We want every unit to not only do its best to perform perfectly given the responsibilities that they have, but we also want them to know that they are not working in isolation, but they also are in touch, or they have to be in touch and in contact with other units, and they have to communicate for the whole system to work. And also, not only we want that between different components of the healthcare system, but also we want that to be the same between different individuals. So a lot of the things in the medical is that a lot of doctors want to, not that a lot of them want to, but like they prefer to just work in isolation. Like, okay, I'm the doctor, I take care of your health, and that's it. But a lot of these providers, healthcare providers, the nurses, the doctors, the technicians, and so forth, they have to know that they are not working in isolation. Based on the situation of the patient, a lot of other nurses or doctors may at some point get involved in the team to be able to provide the perfect care for the patient. And so they have to be able to not only do their best on the job that they do, but also be able to share and communicate with other providers if needed to provide the perfect care for the patient. And these are the two references I actually used for this. I have put